Hi guys, this is Dr. Gupta from Dentistry at Mendon Square. Today I want to talk to you about sleep apnea and why I as a dentist want to say a few things to you. So recently I was at a sleep apnea meeting in Asheville, North Carolina, and something new that was discussed in that meeting was that the statistics used to be 1 in 10 individuals will potentially have sleep apnea. But now it seems like it is 1 in 3. So I felt that it is important for me to spread the word out so that there is more awareness about sleep apnea and what people like myself who are dentists can help you. So when I have a patient in my chair or when my hygienist is seeing a patient, what are we looking for in those patients? We are looking for certain anatomical features that could render that patient to have a more compromised airway, thereby leading to an obstructive sleep apnea condition. Sleep apnea definitely are two different types. There is obstructive sleep apnea and there is a central sleep apnea. The obstructive sleep apnea is more common and the ones in which there might be anatomical features playing a role. So the difference is like there is a garden hose and there is a fireman's hose. So the fire hose is the one that is collapsible. As soon as the pressure goes, the hose collapses, but the garden hose will not collapse. So people who have sleep apnea often have their airway, which is more like a fire hose. So that is something that we look out for. Now, let me tell you why dentistry is important and what is it that we look for when a patient is in our chair. The first thing that we look upon is looking inside the patient's mouth, back into their throat, and we want to see how when the tongue is put out, what can we see off their throat. And in this chart, you can see that when a patient's tongue is out, some patients you can see right inside into the back of their throat, and some you cannot see anything. As we keep moving towards the other side, there is a higher risk that the patient has of having obstructive sleep apnea. The second one here is markings of your teeth against your tongue. It's called a scalloped tongue. The reason this happens, if your tongue is too large or if the mouth is too small for the tongue to be pushed too far against the teeth, which causes these indentations to happen. The third common feature is a narrow arch, in which patients can have very narrow arches, sometimes very crowded teeth, which can also cause a lesser space available to the tongue. And thereby the tongue falls back into the throat, and the same thing happens when the lower jaw is pushed behind. Some of the other things that we look for in a patient's mouth as telltale signs are excessive wear. If the back of the teeth has erosion, that is from acid refluxing into their mouth, causing the enamel to wear away, that is a very common sign of obstructive sleep apnea. Another thing that we look for is heavy growth of the bone on the lower jaw, which may cause for the bone to develop too much and cause that lesser space for the tongue available for itself. And there are many such features that we look for, and therefore I would like to inform my audience that this is something that you should be aware of. Next time you go see your dentist, question how your airway looks, and if you need anything else from my end, happy to have a consultation with you. Feel free to give me a call and set up a 15-minute appointment with me at no charge. Thank you.